Hi everyone, this is Counseling 4500, Chapter 15, An Integrative Perspective. Most therapists consider themselves eclectic, which means that they cover a wide range of theories. At its worst, they pick techniques without any theoretical rationale. So hopefully now that you've gone through this class, you understand why certain therapeutic frameworks were created or developed, right? So you can sort of explain why. And as your assignment, when you were doing your research, you were finding reasons why you were using specific techniques with your client, right? Okay, syncretism. Lack the knowledge and skills in selecting intervention. So hopefully that's not where you are. Looks for anything that seems to work. Makes little attempt to determine whether the interventions are effective. So you haven't done research on it, journal article research to find out if it's effective or not. So all those things are part of this. And we're hoping that you're not part of that type of person. Right? That it might be someone who's really new and doesn't know, and like, well, let's try this, let's try that, but really not understanding why, right? You should now, as a professional, start to operate from a place where the things that you have learned or you experienced will help determine and you can justify why with those reasons. Pathways towards psychotherapy integration. So psychotherapy integration is looking beyond and across the confines of a single school approach to see what can be learned from other perspectives. So what that is saying is that all the frameworks that you have been learning about, some of them all offer something good that from your perspective, I'm sure, right? So why not be able to kind of use a little bit of everything, but at least now you understand. The reason why we ask you to focus on one specific therapy for your first assignment or your major assignment is so that you can kind of like study it for a semester. But after this, you definitely should be integrative. Okay. How can clients benefit from a variety of ways of conducting therapy? Yeah, because you're going to have more than one client, you're going to use different types of techniques for different reasons, right? You might have one client who's trying to lose weight. You might have a client who's trying to learn how to socialize. You're going to have a client who is very upset about being fired from a job or whatever, right? So there's so many different things. And so different techniques might be very helpful for them, right? Maybe one of your clients is trying to figure out what's the point of life, right? So again, you need to be able to use specific things for specific people. But if you are inclined towards one specific one or two of them, that is fantastic. And you can use those things as well. And typically, if you're working on your own, you definitely can choose whatever. But if you work at an agency, they might have specific things. They might say that we're very CBT oriented, or we might be very person centered oriented. So you're like, okay, I get what you're talking about, right? And then from there, operate from that perspective. But you can also bring in your own additional therapeutic frameworks as well when you're working. 4.2% of respondents of a survey said that they are exclusively single therapy model, which means that they're just one thing, right? And that's very few. I will say that I have met Freudians or psychodynamic therapists, so they're very much one, right? They see the world from that perspective, and it's really interesting. It's really, it makes sense to them. I also know people who are very only CBT as well. Right. But there are other people who might be a little bit of everything. But again, it depends on if they're working on their own, where they can say, yeah, I only want to do psychodynamic, or if they're working in an agency where they're like, I'm person-centered and CBT at the same time. Then you're like, okay. Anyways, 95.8% of the respondents claim to be integrative, which means that they're using more than one method. And that's reality, is that most people are using more than one. Okay, integrative is now used to describe multiple methods, so you don't use the word eclectic anymore, but you will hear eclectic potentially in some writings or some people referencing it, and you can sort of tell that they probably learned about therapy and psychology a while back ago, right? So integrative is now the preferred use. So it's characterized by openness to various ways of integrating diverse theories and techniques and enhance the efficiency and applicability of psychotherapy. So the ultimate goal of therapy is to help a person resolve their problems. So, if we can use multiple different ones or therapeutic frameworks to do it, that's great. So the four most common types of integrations are technical integration, theoretical integration, assimilative integration, and common factors approach. So we're going to go and explore these as we go along now. So technical integration, selecting the best treatment techniques for the person and the problem. Okay. Focus on the differences, choose from the many approaches, collection of the techniques that you have, no necessary connection between the conceptual foundations and the technique. So it might be a multimodal. So again, this basically means that they might not necessarily all connect to each other, the therapeutic frameworks or the techniques, but it works for the specific client, right? From the problems that you're hearing them say. Theoretical integration synthesizes the best aspects of two or more theoretical approaches under the assumption that the outcome will be richer than either theory alone. You're integrating the underlying theories of therapy along with techniques from each of those. So here we're saying this is really good with this one and this is really good with this one, but it works even better when you combine them to work on this specific problem. So that's what integration in theory is, right? So here's some examples of that would be emotion-focused therapy, person-centered therapy, then they mix it with Gestalt therapy, with experiential, and then existential therapy. So all of that becomes emotional-focused therapy, right? All right, assimilative integration is grounded in a specific school of psychotherapy, openness to selectively incorporating practices from other approaches. So this one, you might have one preference, like let's say existential, right? But you also understand that feminist therapy is really important, or narrative therapy is really important with that. So then you base it all off of existential first, but then you also talk about those other things. So for example, here is mindfulness-based cognitive therapy is a combination or a assimilative integration of cognitive behavioral therapy along with mindfulness-based stress reduction procedures. So here we're talking about the fact that, certain ways of controlling our breath work or our muscle relaxation and stuff can be helpful when it comes to people and their automatic thoughts or whatever it is. Okay. Common factors approach searches for common elements across different theoretical frameworks. So we're going to go through all the different therapies, let's just say that, and then say, what are the common things that are shared amongst all of them? So it might be such things as empathetic listening, developing a working alliance, an opportunity for catharsis, remember that breakthrough, that aha moment, practicing new behaviors, positive expectations from your client, working through one's own conflicts, understanding interpersonal, which is communicating between people, and intrapersonal dynamics, which is how to communicate with yourself, and then learning to be self-reflective. So if you look at a lot of these therapies, those are things that you probably go, yeah, they all kind of expect us to do these things. Yeah, so this is the common factors approach. The difference between syncretism and technical integration is that with technical integration, you know that techniques are effective for your client. Okay, you're choosing it because it has been empirically researched and is often evidence-based. Or for frameworks that have less empirical observations, the theory has been supported by many psychologists and textbooks. So the difference between the two is that technical, you're educated and you understand what's going on because you've seen the research or you've done the research to see all that stuff. Whereas the other one, we're just choosing and picking because that's like, that's in the toolbox and we have no idea what they're really used for, and we'll try it out. But that's not necessarily the best way because you're wasting people's time. You're wasting your own time. Your clients might go, does my therapist even know what they're doing? Right? So hopefully they should not be thinking that. But unfortunately, there are people who are like that because they have not been able to really learn and steep like tea, in all the different types of therapeutic frameworks and then work on them and try it out and all that stuff. So if you are syncretism, you might not know why you are choosing a specific technique. You're just hoping it will be effective by just guessing. And that is not really good because you are in charge or you're working with people's lives. And I hope that you all take it much more seriously than just guessing. All right. Congratulations, we're done. Yay. Thank you so much for taking this class. All right, bye.